My name is Adam, I'm 18 and I live in Australia. I intend to document my fitness journey and share my thoughts on a variety of topics. I've been training since I was 13, but it hasn't been a linear experience. There have been two major events that have affected my health so far, and I'd like to comment on the first major event in this video. Pneumothoraces. My fitness journey was going very smooth. I was 15 and benching 100 kilograms and deadlifting 175 kilograms. I felt amazing, but a week after deadlifting 175, my first lung collapse happened on the 18th of March 2022. Lung collapse is the easy term for pneumothoraces or pneumothorax. And here's the chronological order of the pneumothoraces. First one happened on the 18th of March. Spontaneous pneumothorax on the left side of the chest after quickly throwing a ball during sport at school. No chest drain insertion. I was just playing sport at school, threw a ball really quick, and instant shortness of breath, pain in my chest, couldn't stand up too easily, called the ambulance, went to the hospital. They did an x-ray and found out that I had a lung collapse on the left side. I went home, I think, that day, and they said I can return to weightlifting in about a week, and I was really eager to return back to it. I went too quickly back into it and effed around and found out, and then on the 23rd of March, so 5 days later, I had another spontaneous pneumothorax on the same side, the left side, and it was about 80% collapse. I was probably working out way too intensely and way too soon, which caused it, and no chest drain insertion, probably luckily. And I just remember waking up that morning at like 4 a.m. and just chest pain, a bad feeling in my gut, and I'm thinking, oh, it's collapsing again. Woke up, mom, told her, called the ambulance, hospital, yeah. Bit of time goes past, and then sometime in May, a spontaneous pneumothorax on the right side of the chest this time. I was playing games when it happened, and no chest drain insertion. I can't recall too much of what happened. Later in May, another lung collapse on the right side of chest again. I noted that I was brushing teeth when it happened. No chest drain inserted. Yeah, it can happen pretty randomly, but you know when it does happen. I do recall a moment on the 18th of July. I don't have any notes on it, but I believe that there was a collapse on that day. I'm not sure which side either. This is all during 2022, by the way. On the 12th of August, I had my first surgery on my right lung. The surgery was called a pleurodesis. What they do is they remove the space between the chest wall and the lung. What they do is they just stick them together so there's no more area there. They can do that chemically or physically. In my case, they did it physically. They pretty much just rub the inside of your lung or chest wall, which will irritate it and make it sticky. When they're sticky, they stick together, and then the area is gone then. About a week after this surgery, when the drain was taken out, another pneumothorax was created when it was removed. And yeah, that was really tough on me in that moment because it's another pushback as soon as that happened. 21st of August, spontaneous pneumothorax on right side. So this is the same side that the surgery was on. So it didn't completely take out the chance of it happening again, because it happened 1.5 weeks afterwards. I was showering at this time, and a chest drain was inserted. At that time, I believe I was in hospital for that pneumothorax. I was in hospital, and then only 6 days later, while still in hospital, I remember I was walking around the ward just to get some exercise in and, maybe help something out. And that night, a spontaneous pneumothorax on the left side occurred. Chest drain was required, and because it was on the left side, I had what's called a bilateral pneumothorax, which is lung collapse on both sides, both lungs. And this was quite it was an emergency, because if both collapse, there's risk that pressure is going to be on the esophagus and on the air pipe, which can lead to some bad complications and maybe even death. So I was flown to Townsville as quickly as possible. Flown from Cairns to Townsville. It only took 40 minutes. It was extremely quick. 3 days later, on the 30th of August, I had surgery on that left side, another pleurodesis, and it was activated physically, like the last one. 9 days later, on the 9th of September, I had a spontaneous pneumothorax on the right side again. It happened as I was walking downstairs, and chest drain required. Shortly after 9th of September, pleural effusion on the left lung, possibly a pneumothorax as well. No chest drain insertion. Pleural effusion, I believe, is just a lot of fluid built up in a location. So that happened. And after that, no other occurrences of lung collapses or pleural effusion. And you might have noticed that all of these were deemed spontaneous. Throughout all these events, no one ever came up with a reason as to why they happened. I started exercising again on the 17th of February 2023 in my final year of high school, grade 12. So throughout the events, the doctors said lung collapses commonly affect skinny, tall young men. However, I didn't fit this description. At this time, I was really well built, wasn't skinny, but I did question one doctor, and they did say that they refer to the skeletal system when they say skinny, meaning an ectomorphic build of your skeletal system. So I don't know how true that is. I also had appointments with a respiratory physician. They believed I may have had Marfan syndrome, which affects the body's connective tissues, but they ruled that I don't have that condition based on my physical appearances. As of now, my 9 lung collapses have been deemed spontaneous. I will say that going through those experiences of lung collapses was scary. It put things into perspective, and it gives you a bit of appreciation for life and the things that you do have. At the time of my first collapse, I think I was about 75 kilograms. I was really strong for my age, and I just felt really good in my body. And then after all those lung collapses and those surgeries and that huge amount of time away from my hobbies and passions, I think I was down to about 60 or 65 kilos, and I pretty much lost all of my muscle, and like my confidence as well. It's weird because during the experience, even though I was losing so much muscle, I'd look in the mirror or like I'd flex my arm, and it's like the opposite of body dysmorphia because I still felt like I had muscle there, like it was still the same size and everything, but it clearly wasn't. And I will put the images in when I edit this video. Apologies if this video isn't well edited or well structured. I'm not used to this, but I thought I'd like to document my experience. I will say that during all of my chest drain insertions, they were all done with anesthetic, so I was asleep as they happened. I didn't do any of them awake. I wouldn't want to do any of them awake. I don't think that'd be a very comfortable experience. But it was very scary having these lung collapses. Just knowing that your ability to breathe isn't very strong. When it happens, you're really gasping for some air. You're very short on breath. The day after you have a lung collapse, when you're in hospital, just walking to the toilet and back, you're out of breath. It's a frightening experience, and it's very painful because you don't want to move your arms around too much, because if you move your arms a little bit, you might get a quick short pain, and it's not fun. You're walking around like an 85-year-old in the hospital. You're taking things as slow as possible, and it's a blessing to have pain medication, because without it you'd be in agony. After my surgeries, they put me on intravenous pain medication, and you press a button and it sends it through your bloodstream, and you can press it as much as you want whenever you feel too much pain, and you won't overdose. That's how they created the machine, and I'd press it as much as possible, and it was really helpful, and it just knocked me out. They'd serve me breakfast at the Townsville Hospital, and I'd just be slumped in my bed, drooling from the mouth because the pain medication just has me knocked out. During my time in hospital, I always try to get a bit of exercise and do my walks around, my laps around the ward, because they just say that's helpful. So if anyone else is in that situation like I was, I'd just say do your walks. After pneumothoraces, do not work out for at least a couple of months. You do not want it to reoccur. I was really impatient and stupid about that. I didn't know how serious something like lung collapses can be, and I did pay the price for that. In hospital, because you're bedridden a lot of the time. Well, you're not bedridden, but you're in the bed for the majority of your day. Your blood isn't circulating very well, so to reduce the chance of getting something like deep vein thrombosis, they have to put leg cuffs on you to keep the blood circulating, and they might also have to inject some medication into your stomach with a needle, which was, it's a pretty painful injection. At least I found it that way. Be prepared to ask someone to shower you, because when you're in that position, it hurts so much to move around. I couldn't even imagine myself showering myself. So that was an experience. During my time at hospital, fortunately my school understood my situation, and they didn't really require me to do any work. And during that time, I could have used my time more effectively. I was really wasting it. I really just listened to music quite a lot, just thought about things. I watched Breaking Bad, the whole series. I watched like an anime or two, which was, just helped me clear my mind and take my mind off of what was happening. Also played a bit of games like My Singing Monsters. Always enjoyed that one. But throughout the time, all the doctors were extremely helpful. I could always ask them questions, and they were very caring of me. Every time I came back to the Inner Cell Hospital, which is where I'm from, and they seen that I was there again because of lung collapses, they'd always empathize with me, and that was just really nice to have that care there. It just, it made you feel good. One of my lung collapses, that bilateral pneumothorax, wow, they put a lot of pain medication into me. Put as much ketamine in me as they could while I was waiting for that flight to Townsville. And unfortunately, I couldn't catch the helicopter there because another boy was in an even more dire situation than me, and he had to get flown to Townsville. So I had to catch the ambulance to Cairns and then catch a plane to Townsville. But while waiting for that, that's probably the most agonizing experience I've ever had. Having both of those lungs collapsed and just waiting for that ambulance to get there, then for the plane to take me to Townsville. I was just grabbing at like my knees and just trying to like squeeze something so then I can take the pain off of my mind. That was definitely an experience. In Townsville, with the surgeries, they have to put you on the medication that hardens your stool for surgery. I can't really remember why they do that, but you don't defecate for a couple days, and then a few days after the surgery they give you I forget the medication as well, but it softens your stool. And that was an experience because I was in my room in the ward, and there was a family next to me because their bed was next to me, and I had to use the bathroom after using that softening medication, and because I didn't defecate for a few days, I really had to unload. And so that family, their family was with the patient, and they were all like talking and stuff, and I was in the bathroom just blowing it to pieces. I was probably there for like 40 minutes getting all of it out. So that was something else as well. I really appreciate what all the medical teams did for me. They did a great job. It's just unfortunate that I don't know what the actual cause of it is yet. I do have an elevated heart rate as opposed to someone of my age and of my fitness level, because I'm resting at about 90 to 100 beats per minute, which is quite high for someone who's I'd say fit and healthy and also young. I'm only 18. I don't know what the reason is for that heart rate. I do have pectus excavatum, but it's not very severe. It's only pretty minor. I displayed it in one of my previous shorts. But yeah, anyone who goes through that experience of lung collapses, yeah, it will eventually end. I might even get another one in the future, but I've been clear of them for 2 or 3 years now, and I'm back to where I was. It didn't take very long for me to regain all of my muscle and my confidence, because I already worked out prior, and my body was, or I was used to working out. I know how to work out well and train well, and I don't know if that's a part of mind muscle memory, but I managed to shoot up to 75 kilograms in no time. I might put a description here how long it took, and I'm also going to show photos of before the lung collapses, during the lung collapses, and also afterwards. But yeah, I'm at my prime now, physique and strength wise, for most strength activities, and I'm just looking to keep going. I really did miss out on cardio a lot during that time. I didn't do too much cardio the past few years, and maybe that might have been why I had all my lung collapses. So this time around, I'm doing my cardio every single day. I'm getting at least 90 minutes of moderate cardio per week, just to make sure that right now my heart or my cardiovascular ability is not what is causing the lung collapses. At least I can rule something else out. Yeah, if I have anything else that comes to mind about this topic, I might upload a quick little short, but I think that's about it for this video. Thanks for watching.